Which of the following is a potential consequence of using a hyperosmolar priming solution during CPB? A. Increased risk of clot formation. B. Increased fluid retention in tissues. C. Decreased blood pressure and perfusion. D. Elevated levels of potassium in the blood. Answer: C. Decreased blood pressure and perfusion. Explanation: a hyperosmolar priming solution can cause fluid to move from the bloodstream into the tissues, due to osmotic effects, leading to a decrease in circulating blood volume. This can cause hypotension, low blood pressure, and inadequate perfusion, which may affect organ function and the success of the procedure. Proper osmolarity is critical to ensure optimal fluid balance during CPB. What is the primary reason for the use of mannitol in the priming solution for CPB? A. To prevent excessive clotting. B. To reduce kidney injury and protect organs. C. To stabilize blood pressure during surgery. D. To increase the osmolarity of the solution. Answer: B. To reduce kidney injury and protect organs. Explanation: mannitol is used in CPB priming solutions primarily as an osmotic diuretic. It helps prevent kidney injury by promoting diuresis and protecting the kidneys from ischemic damage. It also reduces the risk of edema in other organs, like the brain and lungs, by drawing excess water into the blood vessels. Which of the following is a common complication associated with the use of high-concentration glucose solutions in CPB circuits? A. Hyperkalemia. B. Hypotension. C. Hyperglycemia. D. Acidosis. Answer: C. Hyperglycemia. Explanation: high-concentration glucose solutions can cause hyperglycemia, especially in patients with diabetes or impaired glucose metabolism. The elevated glucose levels can result in insulin resistance and increase the risk of complications such as poor wound healing, infection, and organ dysfunction. Monitoring glucose levels during CPB is essential to manage this risk. Which of the following is the most appropriate priming solution for a pediatric patient undergoing CPB? A. A hypertonic solution to reduce edema. B. A balanced crystalloid solution with electrolytes. C. A blood-based solution to increase oxygen carrying capacity. D. A glucose solution to provide energy. Answer: B. A balanced crystalloid solution with electrolytes. Explanation: for pediatric patients, it is essential to use a balanced crystalloid solution, such as Ringer's lactate, that contains the appropriate electrolytes. Children have smaller blood volumes, so it is critical to avoid excessive dilution, while also maintaining a proper electrolyte balance to prevent complications such as acidosis or electrolyte imbalances during CPB. Why is it important to monitor electrolyte levels closely during CPB, particularly with the use of priming solutions? A. To ensure proper coagulation and prevent bleeding. B. To prevent hyperglycemia during bypass. C. To maintain normal muscle and nerve function. D. To prevent infection and inflammation during surgery. Answer: C. To maintain normal muscle and nerve function. Explanation: electrolytes, particularly potassium, calcium, and sodium, are essential for normal muscle and nerve function. During CPB, electrolyte imbalances can lead to dangerous complications, such as arrhythmias, muscle weakness, or neurological issues. Proper monitoring and adjustment of electrolyte levels are crucial to prevent these problems and ensure the patient's safety during the procedure. What is the main concern when using a non-buffered priming solution like normal saline for CPB? A. It may cause fluid overload. B. It can lead to metabolic acidosis. C. It will increase the risk of thrombosis. D. It can cause hyperglycemia. Answer: B. It can lead to metabolic acidosis. Explanation: non-buffered solutions, like normal saline, do not contain agents to regulate pH. During CPB, the lack of normal circulation and oxygenation can lead to an accumulation of CO2, which causes acidosis. Non-buffered solutions do not neutralize this acid load, making metabolic acidosis a potential risk. Which of the following components in the priming solution for CPB helps in preventing organ damage during prolonged bypass? A. Mannitol. B. Albumin. C. Heparin. D. Sodium bicarbonate. Answer A. Mannitol. Explanation: mannitol, an osmotic diuretic, is used to prevent organ damage during prolonged CPB. It helps reduce kidney injury by promoting urine production, protects the brain from ischemic damage, and reduces tissue swelling. Its osmotic effect draws water into the bloodstream, preventing edema and protecting vital organs from the harmful effects of ischemia. What is the most significant risk of using an excessively large volume of crystalloid solution in the priming of CPB circuits? A. Decreased blood viscosity and oxygen carrying capacity. B. Risk of hyperkalemia and arrhythmias. C. Hypoglycemia during the procedure. D. Increased risk of clot formation due to dilution of clotting factors. Answer A. Decreased blood viscosity and oxygen carrying capacity. Explanation: excessive use of crystalloid solutions dilutes the patient's blood, lowering hematocrit levels and decreasing the oxygen carrying capacity of the blood. This can result in inadequate tissue oxygenation, especially in vital organs. It is essential to carefully calculate the volume of priming solution to avoid excessive dilution. Why is potassium usually added to the priming solution in CPB circuits? A. To promote diuresis and fluid loss. B. To enhance the contractility of the heart during bypass. C. To prevent hypokalemia and maintain electrolyte balance. D. To improve the ability of the heart to maintain rhythm. Answer C. To prevent hypokalemia and maintain electrolyte balance. Explanation: potassium is added to the priming solution to prevent hypokalemia, which can lead to serious complications like arrhythmias. Maintaining an adequate potassium concentration is crucial for proper cardiac and muscle function during CPB, ensuring the heart maintains its normal rhythm and the body's cells function properly. What is the main function of adding heparin to the priming solution during CPB? A. To prevent hemolysis of red blood cells. B. To improve oxygen delivery to tissues. C. To reduce the risk of blood clotting in the CPB circuit. D. To stabilize blood pressure during bypass. Answer C. To reduce the risk of blood clotting in the CPB circuit. Explanation: heparin is an anticoagulant that is added to the priming solution to prevent clotting in the CPB circuit. When blood is exposed to the artificial surfaces of the bypass machine, it can trigger clot formation. Heparin inhibits the clotting cascade, ensuring that blood flows freely throughout the circuit during the procedure.